Are you suffering from severe and persistent lateral hip pain, making day-to-day activities and sleeping problematic? Hey everyone, this is Dr. Zach Wade here at Performance Sport and Spine, and these are common symptoms of greater trochanteric pain syndrome. In today's video, we'll discuss what this is and the best ways to resolve it. So this condition presents as persistent lateral hip pain that may radiate down into the buttocks or the lateral thigh, and it's usually a constant dull achiness, with the pain may become sharp or stabby with rapid movements or prolonged position. So greater trochanteric pain syndrome covers several different conditions, and it's an umbrella term, covering things like gluteal tendinopathy and gluteal bursitis. Now this paper found that gluteal bursitis is only found in isolation 8% of the time. So often people are misdiagnosed with gluteal bursitis when there's something more going on. Things rarely happen in isolation. So what's causing your pain? Now often this pain can be very atypical and very severe, so it can worry people. Well, it turns out that if you look at this picture right here, the tissues between the IT band and the greater trochanter of your bone can get excessively compressed. Now the operative word is excessive. Now tissues are always getting compressed, but at some threshold they can become irritated. So reducing these positions is very important, which we'll cover next. Another pain generator can be the gluteal tendons of the lateral hip. So now we're going to go over 5 positions and movements that we need to address and minimize if you do. And often when I have patients come in, they don't maybe think they're doing this as much, but after we talk about it and they have a few days to think about it, they find that they do a couple of them a lot more than they do. So the ones that you find you do the most, focus on those and reducing. So the main movement and position we want to reduce is the adduction, or bringing the leg across the midline, as that can put increased compression on that soft tissue between the IT band and the greater trochanter. The first thing is standing. So often people will hang on their hips. So let's say that the right side is the symptomatic side. If you find that you're often standing, kind of leaning into that causes compression of that IT band against the bone, irritating those soft tissues. So it's really important to either stand neutral or actually shift your weight temporarily onto the other leg to offload this leg. So we'll go over sitting now. Now often the hip will feel tight, so when people are sitting they want to cross their legs because it provides a stretch, and that probably will provide short-term relief, but again it's increasing the compression of soft tissues, further causing the chronicity. So when you're sitting, it's important to not cross your legs. Try to keep your knees shoulder width apart when sitting. So another helpful cue I found with patients is sometimes if they're sitting on too low of chairs, their hip is flexed too much, which can cause too much irritation. So having a higher chair that we demonstrate here can help decrease that angle and decrease the irritation of the tissue. So going up and down stairs can be another irritating movement. So as I demonstrate here, as people walk up, sometimes their pelvis will tilt down, causing compression of the soft tissues. So as you walk up the stairs, it's very important to use a neutral pelvis, and that can often be aided by using the handrails as we demonstrate here, on side to side as you hold, making sure as you step up, the pelvis stays parallel to the floor. So with walking, sometimes people have a very narrow walk gait, or they actually have a crossover, one leg crosses over. Now this can irritate those soft tissues. So if you do this and having a wider stance while you walk helps, do it. If not, don't worry about it. So often with this condition, finding a position that's comfortable at night can be very frustrating. So there are a couple things that we can address here that may be helpful. So the first is laying on your back with your knees slightly bent with the pillow placed under your legs. Another good option is laying on the unaffected side down with the pillow between your knees, making sure your knees are spread apart in a comfortable position, offsetting any compression of that IT band. And then lastly, if you do need to sleep on that side, place a pillow underneath to try to reduce this compression as much as possible. And then lastly, and probably most importantly, is just stop stretching your hip. This is not a lack of flexibility problem, this is not a muscle tightness problem. The soft tissues are irritated and the muscles are tight to protect it. And patients that I have come in that have this condition, that have been stretching their hip for long periods of time, they're always amazed that when they stop stretching for even a few days, how much better they feel. So now we'll cover exercises for this condition. So we recommend 3 to 4 times a week, 2 sets of 8 to 10 reps. We'll go over several different exercises with 4 different tiers, from beginner to most advanced. So one important factor that's often misaddressed is increasing the intensity of the exercises. So whatever exercise you're doing, at the first week the effort is a 2 or 3 out of 10, by the 3rd week it should be a 4 or 5, and by the 5th week it should be a 6 or 7. It's important to increase the intensity and make the exercises more challenging. So the seated clamshell, so in a seated position with the band around your legs just above the knees, and we like to put a ball or something between our knees so we don't press our knees in too much, causing compression of that soft tissue. So you're going to press your knees out slow, holding the ball with one hand, and then come back. Again, you should feel some gentle dull tension on your posterior buttocks, and your feet should be a little wider than shoulder width apart. And again, make sure you don't bring your knees too close together as you come back. And also sometimes the affected knee won't go out as far as the other one. So really focus on making sure that you push the weaker leg out and emphasize the symptomatic side. So glute bridge. On your back with your knees bent, drive your hips up towards the ceiling. Feel some gentle dull tension on your posterior buttocks. Pause and then come down. Again, try to keep the tension out of your back and focus on your glutes or your buttocks. Some people may help to dig their heels in to emphasize their hips more. Place a band around your legs, pressing your knees out as you drive your hips up. So you'll do this in normal stance. Then you'll do stagger left, so bring your right foot back, your left foot forward. Again, drive up with your hips. Notch your quad under your back, slow tempo, pause, and come back down. And then you're going to repeat by doing the other stagger position. So right foot forward, left foot back. Drive up with your hips. One thing to note, with the foot that's back on the affected side is going to be the harder one, so you may have to reduce the reps and then build strength up over time. But again, emphasize that posterior glute and minimize any quads or back. So box squat. With a box or a chair behind you, you're going to put your feet in squat position, and then you're going to squat down slow tempo 2 or 3 seconds. You can use your arms as a counterbalance, and then stand up 2 or 3 seconds, trying to emphasize your hip. Your weight should stay on your midfoot, and again, it should be slow, and you don't want to drive your knees forward, and you should feel some gentle low tension on your posterior butt or glutes. And again, it's slow tempo. And then after we do that, we're going to stagger. So we're going to bring one leg forward and one leg back, and then squat again. Now it will probably be harder with the back leg being on the affected side, so you may have to reduce the reps, but again, it should be slow tempo. And again, try to emphasize the hip and load the butt. Again, you can use your arms to counterbalance if you need, or you can reduce the range of motion if it's too challenging initially, and then increase the range of motion as you get stronger and more comfortable with the position. Again, we're looking for gentle low tension on that posterior gluteal, and it should be harder on the side of the leg that's backwards. Again, slow tempo, 2 or 3 seconds down, 2 or 3 seconds up. So in a sideline position with the band around your leg just above your knees, and again, that ball or that pillow between your knees, keeping your feet stacked with them behind your buttocks. Press your up leg up towards the ceiling. Feel some gentle low tension on that posterior buttocks, and then come back down. Again, slow, 2 or 3 seconds up, and 2 or 3 seconds down. Now on this one, you're only going to do the one side. Don't lay on the affected side down, as that can cause additional compression and may irritate the hip. Again, up slow, feeling that gentle low tension on the posterior buttocks, and then down. So the second tier would be doing that same squat, slow tempo, but again, holding a light weight, and again, squatting down slow, 2 or 3 seconds, and then up. Doing it in the normal stance, in the staggered forward left stance, and the staggered forward right stance. So in a standing position, place a band around your feet and have your feet wider than hip apart. You're going to press one leg back at a 45, feeling gentle low tension on this posterior buttocks, and then return to starting position. Again, press back as far as you can, and return to the starting position, and then repeat on the opposite side. If it's too challenging with the band, you can do it with just your legs, and again, just go slow and pause at the end. And you may feel as you challenge this leg that you feel tension on the stance leg. That's normal. So leg raising the sideline position. So lay on your side with the affected leg up and a pillow underneath your foot to keep it from falling into adduction too much. And you're going to raise your leg up towards the ceiling. Feel some gentle low tension on your posterior buttocks, and then back down onto the pillow. Again, raise up slow, pause, and down. You should feel tension on your buttocks, not your back. And if you're rotating your back too much and you feel it in your back, make sure to press up against the wall more. Keep your leg back and focus on just the height that you can do with your hip, and don't compensate with your back at all. Again, you should feel some gentle low tension on your posterior buttocks. So a reverse lunge, you're going to, in a standing position, step one leg back and lunge down slowly to tolerance, and then return to starting position. If it's too easy, you can use a weight like I'm doing here to increase the difficulty. As you step back, lunge straight down and try to minimize any forward bending like we demonstrate here. You should feel tension in the side of the hip that's not lunging backwards. So banded crab walk. With your band around the midfoot, sink back into your hips and then slowly walk laterally, keeping your feet wider than shoulder width apart to tension. You should feel gentle low tension on both posterior buttocks. So single leg glute bridge. So bring one leg off the ground and one heel close to your buttocks, and with the hip of the leg on the ground, drive up with that hip, pause, and come down. Again, it may help to dig your heel in and lift your toe up, and then drive with your hip, trying to minimize any hamstring or low back. Now this can be a kind of big progression, so it may help to initially come up with both legs, lift one leg up, and then return down as a progression. And as you get stronger, then you can progress to this one. Again, you would repeat on the opposite side, so bring that foot down, bring your left leg up towards you, and then driving up with your right hip, trying to minimize any hamstring or back, up, down, slow, and again, you can add a pause, but try to work on increasing the range of motion as you get stronger. So step up. With a small box or step, you're going to place the leg up. On top, you're going to lean forward so your knee is past your toe and your torso as far forward as you can, and then using that glute, you're going to drive your leg up, down, slowly. Try to press off with the other leg as little as possible, and since we're trying to emphasize the glute, you want to use as little quad as you can. So again, keep the knee past the toe, drive up with your glute, nice and controlled, and then down. If it's too challenging, reduce the height of the box Or just work on this concentric or eccentric. Just work on going up or down. Unfortunately, this condition won't get better overnight and it can take up to 2 to 3 months to get better. So trust the process and just look for consistent progression. And then secondly, some discomfort is normal. So we typically recommend about a 3 out of 4 out of 10 as the upper limit, and it should dissipate within 24 hours. However, this will be variable to the individual. So how do we diagnose this condition? Well, it turns out all you need is a good clinical history and physical exam, and imaging is rarely needed. So the cardinal symptom of this is tenderness of the greater trochanter, which is the bone on the side of your hip over the posterior aspect. So pressing on this should reduce your pain. Often single leg stance holding for less than 30 seconds with pain or discomfort is indicative, and there are 2 orthopedic tests, the Faber and the Fader, that can also be helpful clinically. So what are some risk factors for this condition? Well, age is one, obesity, leg length difference. Now this needs to be quite extreme, probably more than half an inch to be problematic. Hip and knee OA, and then females typically have this more often than males, and then one reason that may be is their pelvis is wider, which just increases the chance of compression and irritation of the soft tissues. So now we need to briefly talk about returning to normal. So some of these positions I've told you to reduce. Once the irritation and the pain has gone away, you need to slowly add them back into your life. So if you cut your finger and you had a scab, you would maybe stop bending your finger for a while, but once the scar tissue formed, you would bend your finger. So once the pain is gone, go back to daily life. And then lastly, making sure this condition doesn't come back. With all my patients that have this, they need to continue to do something that strengthens the hip. That's something that they like. So typically I found that if you do something that's resistance training twice a week, this will keep this away. If you get better and then stop doing any exercise, it'll slowly get back. So find something that you like, whether it's Pilates, hiking, resistance training, a gym at a class. Just find something that you can do as a lifestyle change for a long time.